Morning, and thank you for the opportunity to present our research. The purpose of this study was to evaluate the safety and efficacy of microwave ablation and DEB-TACE on hepatocellular carcinoma at a single center. Here are our disclosures. Hepatocellular carcinoma is very common. It's the third most common cause of cancer mortality. It's the most common cause of death among patients with cirrhosis. And common risk factors include hepatitis B, C, alcohol, and NASH. All thermal ablation methods are negatively impacted by the local cooling from blood vessels. This is known as perfusion-mediated cooling, also known as the heat sink effect. Traditional antennas have been plagued by being very invasive, traumatic, because they have large diameters. There's a proportional relationship between the power that a traditional antenna can safely handle to the diameter. Now, this has been somewhat remedied by internally cooled probes, which allow for smaller diameters, large ablation zones, and less collateral damage of the normal surrounding parenchyma. One way to counteract the effect of perfusion-mediated cooling is the use of embolization agents. It can be done also surgically with a Pringle maneuver, but in general, we use DEB-TACE in combination with microwave ablation to decrease the local blood supply and to deliver a sustained and controlled release of chemotherapy into the tumor bed, preventing systemic toxicity. Our primary endpoints were complete ablation, local tumor progression within 1 centimeter of the ablated site, new hepatocellular carcinoma at non-ablated sites but within the liver, and complications surrounding the procedure. This was a single-center retrospective study. We followed 76 patients who had 85 tumors. All patients got CT-guided percutaneous microwave ablation. All patients also received DEB-TACE 1 day prior. Patients with extrahepatic disease, vascular invasion, or a bleeding diathesis were excluded from the study. Our study population was mostly male, white, with a mean age of 66 years. Most common comorbidities were hypertension and diabetes. Most patients were considered Child-Pugh Class A. Most tumors were small. At 1 month follow-up, 91.9% of patients achieved complete ablation, while 6.8% of patients had local tumor progression. In general, the overall probability of recurrence increased with time. 5.3% of patients developed new lesions at 1 month, and we found a statistically significant difference in the probability of developing